We're going to be talking about facial aesthetics or facial beauty and the facial proportions. So while you people come in and ask questions, I'm going to answer some of the most commonly asked questions, especially on YouTube. Many patients are asking us various questions with relations to this. Now, at the outline, I would just want to say that facial proportion is a very key aspect in facial aesthetics. When I say facial proportion, it's about the upper third, various subdivisions of the face, the proportion of the nose to the rest of the face, proportion of the lips to the rest of the face, the jaws, the different shape of the teeth. The whole face can be divided into various golden proportions. Now, this golden proportion, the Greeks used to call it a side, and that's about 2.7. So, this is the ratio that we are looking at. And if this ratio is met in the various subunits of the face, and then we tend to get what is called as an attractive or a beautiful face. So, here at Richardson's Hospital, we are basically doing all kinds of reconstructive surgeries, all kinds of maxillofacial surgeries, facial plastic surgery procedures that are on the face. And so this is what we deal with. We also deal with hair transplantation. Yeah, I've just got a question about someone wants to know about the hair transplant success rate. That's pretty high if you do it well. I mean, in the sense that if you take 3,000 grafts, you will probably get 95% of them growing back at the area. We do liposuction as well, and most of the liposuction is not done on the face. Submental liposuction is the area where you can do liposuction. Whenever we do a genioplasty, we do an intraoral liposuction type of a procedure to remove the fat there and tighten it, so you get nice, strong jawline with that. So that's what we can do with the suction. So I'm just going back to my analysis of this face with regards to the facial proportions. Yeah, hi all. I'm just seeing once in a while on the computer here to find out and about the kind of questions that your people are asking. All right, so I was talking about the facial balance and how that's important for facial aesthetics. Now, it's very important to keep this in mind because a lot of the issues are actually with the facial proportions. But is facial proportion the only thing causing for facial aesthetics? No. You also need to have facial symmetry. And of course, you need to have a proper function. So all of these are very important, but the facial proportion is very essential. And so whenever patients come to us, and sometimes we do this full facial makeover, we tend to move the jaws, we do bony work on the jaws, we can do bony work on the nose, we can do soft tissue work under the nose. So all of that can be done in one go. When we do multiple procedures on the face, and then it is about, like I tend to call those as a face makeover surgery. So with regards to how you can take appointments, we'll give you a WhatsApp number. You can contact on this number 944-318-2860. And someone wants to know the success of jaw surgery. I think 100%. I mean, if you can plan well and execute it precisely as per the planning that you've done, yeah, it's 100%. I don't think you need to worry at all. Very rarely you have some issues, some troubleshooting, which you might have to do for this patient. But in the long run, no, I think you will have a very high success rate. All right, I'm going to look at more questions. Thank you for all you guys. I've seen many of you have joined. So do shoot in your questions. I've not come on live on Instagram before. So this is the first time around. And if it's useful, then you can also send me messages about the topics that you want me to talk on so that it's more useful and the session is going to be more informative. Okay, so you want to know about jaw surgery. Jaw surgery is a part of maxillofacial surgery, so to say. But since there are two jaws, and we can move these jaws today in any direction, literally. So the upper jaw can be moved up, can be moved back, it can be rotated, both in the clockwise and in the anti-clockwise fashion. Why am I explaining all this? Because these movements not only improve the function of the patient, but more importantly, also improves, augments the facial aesthetics by improving the proportion. Similar with the lower jaw, just the chin can be brought forwards. If you see my videos, I keep mentioning about how you could do a vertical augmentation of the chin, a horizontal augmentation of the chin, how you could increase the width of the chin, decrease the width of the chin, and mind you, with no implants. This is just contouring the existing lower jaw of the patient. So that's with the lower jaw, the chin, and then you can move the entire jaw. Various osteotomies that you could plan. The workhorse of this is like the BSSO, various modification of this that can be used in order to move again the lower jaw in different directions. Yes, someone wants to know if scars can be hidden with hair transplantation. We do them. Yes, I cannot say for all scars, but yes, a lot of these scars can be very, very beautifully camouflaged with hair follicles. All right, so we have here some before and afters for you. Can you see these? Can you see the before afters? About मुझे चिन और नोज की सर्जरी करवानी है, कोई साइड इफेक्ट तो नहीं होती? नहीं, साइड इफेक्ट तो नहीं होता चिन और नोज सर्जरी में। मैंने ऑलरेडी बोल दिया है पहले ही कि इसके लिए प्लानिंग की जरूरत है, और अगर हम लोग इसको प्रिसाइसली करेंगे प्लानिंग के बाद, आपको लॉन्ग टर्म कोई भी इश्यूज नहीं होने वाला है। हाँ, इसको हीलिंग के लिए टाइम लगेगा, 7 days लग सकता है, 10 days लग सकता है, पर उसके बाद आपको कोई प्रॉब्लम नहीं होने वाली। About PRP therapy, you see, it's not exactly in the topic for today. Hair transplantation is still in the topic because when you talk of facial proportions, hairline is a part of that. So I just tell you about PRP. We here use PRP therapy like, we ask the patients to go for PRP therapy once every 3 weeks. So the PRP is derived from the patient's own blood, as you would know. The best thing about this is there's no side effects. I do agree it doesn't work for all patients. In our hands, it works for close to 90%, maybe 85% of our patients. It doesn't work well for all patients, I have to admit. But since there's no side effect whatsoever, and so it's a very, very useful procedure that you could try on if you're a good candidate for this PRP. All right, so do remember the face is between the hairline and the Adam's apple and between the ears. So if you have a very large forehead and a chin that's very short, then you might have to also do procedures on the hairline and on the chin in order to get that balance going. Okay, right, what else do we have? So they want to know about the type of rhinoplasties here, and they want to know if rhinoplasty is really atraumatic. Someone's asked me if closed rhinoplasty is atraumatic. Now, what does trauma mean? Trauma is an injury. Can you do surgery without a trauma? Absolutely no. You have to do abracadabra. So do remember, every surgery is traumatic. What can a good surgeon do for you? It's like he can do the surgery with least amount of trauma. He can do it with minimal damage, but it's nothing like a surgery with no damage because you have to cut the nose. Now, why would you want to call closed rhinoplasty atraumatic? It's just a marketing gimmick because people want to say that this technique is superior than that, or so on and so forth. But I think it's absolutely not true. A very versatile surgeon will be able to use any technique to get the results. The whole concept is to get the face or the nasal shape, the function. And I have to tell you, and I've heard this from other surgeons as well who do a lot of rhinoplasty, who are world-class rhinoplasty surgeons, that only a dog will be able to see the scar, if at all there's any, even with the open rhinoplasty. And do remember, it's just the two ways of addressing the same thing. You can have multiple ways to skin a cat, but the important point is how precisely, how perfectly, how consistently you can keep doing that. So that's the take-home message here. It's not just like, oh, I'm doing this and this technique is atraumatic. No. It also depends on what procedure you need to do. You just want a 2mm refinement on your tip? Well, you don't need to do a lot of surgery for that. But you want to do everything on the nose. You have to do on the bony part of the nose. You have to do the septum, the septal reconstruction, and so on and so forth. So I think this is a call that the surgeon should make. The approach really doesn't tell you that it's a superior or an inferior approach. Yes, that's a very good question, Aishwarya. You're asking me about a square face. And it's a lot of concern that patients ask us. Square face is not only because of mesenteric hypertrophy, that's your question, but very often it's related to mesenteric hypertrophy, not always. What happens when you have a hypertrophic masseter? You hypertrophy, meaning if you start using your muscle, it gets bigger and bigger. When your muscle gets bigger and bigger, the masseter is attached onto this part of the bone, the angle of the mandible or the lower jaw. So that stimulates the bone to grow. Hence, instead of a nice angle that you need to have, you're going to have a 90-degree angle there. And that makes the face look square. Now, how do we correct this? I call this technique angle osteoplasty for want of a better terminology, but the idea is to work around the attachment of the masseter and slightly anterior or ahead of that in order to shape the face, slim the face, or get the lower third of the face or the lower jaw narrowed in such a way so that it looks more aesthetically pleasing. And do remember, nothing is going to be done from outside the mouth. It's all done from inside, so you're going to have no scar whatsoever. Yes, so does overbite the front counts can with jaw surgery? Absolutely. You see, overbite itself can be corrected with surgery. In fact, that's the best way because overbite is an indication of something that's not happening well with the bone relationships. We might have to add orthodontics with it, be it aligners or braces, but that's the best way of correcting it and not crowns. Now, if you've already got crowns done and you still have a jaw issue, don't worry, we still be able to correct that. It can get a little bit tricky, and sometimes in rare patients, we might ask them to go in for a new set of crowns after the jaws are put in the right place. But yes, we can absolutely get the crown sorted off. Septoplasty by rib harvest is safer. Look, rib harvest is a very safe technique if it's done again, like any other surgery, by expert surgeons. Now, we've just given one of our paper for publication where we've documented more than 500 consecutive patients of rhinoplasty that have undergone rib in less than 2 years. So you can see the amount of work that we do here. And there is literally less than 1% complication. And I say complication, it also means a swelling or a collection or any blood discharge the patient might have in the first 10 days. So it's a very safe procedure. And the beauty about it is you're able to get enough rib that can go and fuse to the part of the nose, and then that stays for life. The breathing can be improved, the shape can be improved. You have enough quantity of the rib, and for female patients, it's an even better boon because there's no scar. So we use a nice inframammary incision. The incision is placed under the breast, so there's going to be no scar visible as early as 2 weeks after surgery. So that's the advantages for rib. Now, you also get to buy irradiated ribs in certain countries like the US, other Western countries. And then if that's the case, yes, we could do that. But in the Indian scenario, we do not get to buy them at the moment in the market. And hence, this is the best other way to go. And we have some more questions. Yes, absolutely. That's a very basic thing. Can rhinoplasty reduce the nose size? Absolutely. So remember, rhinoplasty can reduce the nose shape or size significantly. We can also increase it. When we reduce it, we call it reduction rhinoplasty. And when we increase it, we call it augmentation rhinoplasty. Usually when you reduce it, we do not need a lot of rib or cartilage from any other part. And usually when we augment it, we need rib to get that extra size in there. So that's two basic differences. And yes, you can reduce the nose, very commonly done, both at the bony level and also at the tip where there's a combination of bone and the cartilage. Okay, what's the golden ratio for the face? So the golden ratio, I just started with that. So it's between the length and the height. So you're gonna have about 2.7. That's the ideal measurement. Now, as long as we get the face in that ratio, the face is going to be more appealing. More important than just the golden ratio of the face per se, here I'm stressing the importance of the various proportions of the subunits of the face in relation to another subunit on the face. For example, your relation of the chin to the nose, relation of the chin to the eyes, the forehead height in terms of the chin height, what about the length of the nose with relation to the length of the chin? Those form proportions. And if these proportions, there's a lot of proportions that you can calculate, I think about 800 of them or even more. So if these proportions are improved, augmented, tweaked, and then the patient's end result is better. And that's how we're able to decide. Of course, we have to take into consideration the nerves, the teeth roots, other issues, the sinus, the orbital flow, whatever it is, the anatomical constraints that we have, and keep those in mind and then plan our procedures. And just so that you know, we also get a lot of help from software. We also get help from other team members that we have. We have a very strong team here. We also have good support from the anesthesiology team. So it's because of all this, we're able to do these procedures. Some of them can be even quite long. We need hypotensive anesthesia so the patient doesn't bleed a lot. And I just mentioned a little bit about software, but I think, yeah, someone wants to know about this hemangioma. Now see, hemangioma is a tumor that's because of high flow blood. It usually starts when the patient's about 8, 7, 10 years or so, very rarely from birth, and then keeps growing in size. There are different types of hemangiomas. But if you have any issue that a hemangioma has caused, that's there with you left as a residual issue or a defect, I think we should be able to sort you out. So you can send us your pictures and we will give you the best solution with regards to hemangioma. Yeah, so I think don't worry, your broad nose can be rectified, and I think you will be in a position to laugh more. But another thing, you see, even if you have a broad nose, I think a smile adds a lot of value to your face. And so if you have a broad nose, it still doesn't matter as long as you can smile. And so that's going to give you a much happier outlook. So Stanley, the time that the rib harvest takes before you get back to gym, for example, is about 4 to 5 weeks. But if you want to get back to normal life, like walking or anything, it's just a day. In terms of how long the pain will linger, a day to 2 days, and at the end of 7 days, we remove the stitches, or it might be 8 or 9 days in a worst case scenario. So now you understand the whole healing in terms of rib harvest. So Akash, don't be depressed because of your cleft lip. There's nothing in life more beautiful than life itself. So we can try and sort that out. Do contact us on your WhatsApp number and we'll see what we'll advise the best that can be done for you. And with regards to your nose के हड्डी बाहर है, तो हाँ, तो वो तो मैं अभी बता रहा था आपको कि नोज की हड्डी अगर बाहर होगा तो उसको सर्जरी में हम उसको शेप में ला देंगे. अगर साइड से बाहर दिखे तो हम उसको हम बोलते हैं. अगर वो टेढ़ी मेढ़ी है तो वो भी सही हो सकती है, या आगे से बाहर है, सेप्टम टेढ़ी है, वो भी सही हो जाएगा. तो जो भी प्रॉब्लम है नोज में, हड्डी जहां भी बड़ी है, वो हम सही कर सकते हैं. बहुत ही सेफ है, बहुत ही प्रिडिक्टेबल है. हाँ, छोटी सर्जरी नहीं है क्योंकि इसको जनरल एनेस्थीसिया में किया जाएगा. 2-3 घंटे तक लग सकते हैं और आपको हमारे साथ 8 से 9 दिन रहना भी पड़ सकता है. बट सर्जरी में आपको बहुत अच्छा रिजल्ट मिल जाएगा. स्वाति, what procedure can get a scar removed from your nose? See, literally no procedure can absolutely remove the scar away from not only your nose, from any part of your body. Because, you know, a scar, once it's there, we'll have to excise it, or we'll have to do laser, or whatever it is done. Usually I tell my patients that we can improve this scar, meaning we make the scar look better than what's looking now. Now, in some locations on the face, the scar can be made to look so good that it looks as if it's vanished. But in reality, it's still there. But the other person cannot see. So that's like the best result, the wow results. And sometimes a scar may not improve at all. So we tell patients as to which scars, for which patients in what location are ideal for a scar revision. Because then if it's not an ideal, then we tell you that you're not going to get very good results with that. Yes, we do have peak facility, absolutely. We can form your angle, or we can form your chin or cheek or whatever it is. We can do peak implants in one patient, just so that you all know we place 17 peak implants. So yes, we can do peaks. It's not a big deal at all. So about the cost for rhinoplasty and the cost for the procedures, I keep telling the patients who contact us, I'm not the right person. Do WhatsApp us, because we have a separate dedicated team for that. They will give you an insight about the cost with relation to what procedure you need. Also, it will include the hospital stay, for example. It might include other things like implants, if the case is. So, do you have a break in the nose? Yes. So see, breaking the nose is called as osteotomy. Not always we need to break a nose. So we make osteotomy cuts here, not for all patients. Sometimes you can also just grind the bone off. That we use a rasp. We use a raspitory. The raspitory could be manual or it could be motorized. like with a striker. So whatever it is, there will be work done on the bone. And do remember, when you work on the bone, it takes longer to heal because bone takes longer time to heal. So that's about 4 weeks. So you're from Pakistan, hi, but YouTube पे ये problem है sir. So see, the thing is, whatever आपको doubt है, आप हमें contact कर सकते हो. हम उसको we will try and help you. उसका जवाब हम दे देंगे maximum जितना होगा. Or what is that? Okay, so you have any alternative for distraction osteogenesis? Some probably, I've been told that it's already time up. We need to go and I will start my next surgery in about 15 minutes. So I would answer this one question about distraction osteogenesis. It's an amazing procedure. We are world leaders for maxillofacial or craniofacial distraction. You can Google us up on any platform. You can see we've got tons and tons of literature published on anterior maxillary distraction, on even other types of distraction. So what is distraction? Distraction is basically growing new bone for the patient without putting the bone from elsewhere with the help of devices. So even if it's a lower jaw or upper jaw or entire craniofacial skeleton, we can devise distractors. Most of the current distractors that we use for our patients are PSI, we call them, patient-specific implants. These implants are placed on the patient after surgery and then they're turned daily for a period of days till the patient's own body deposits new bone in the region where we want it to, and then we remove the screw and the bone gets consolidated and stays there. There are, like I said, many, many different amazing uses of distraction osteogenesis. And depending on the patient, depending on how severe the defect, it can work amazingly. It can work wonders. Do check our website or our YouTube channel to know more about this. We've got patients, many of them where we've distracted as much as 40 millimeters, 4 centimeters of new bone. And again, every patient is not a good candidate. And also do remember, it's a little laborious process, both for the surgical and the doctor team and for the patient. The hospital stays longer, but yes, you already know its advantages. All right, so I just want to take one more question. So brace surgery के बाद, jaw surgery के बाद क्या braces जरूरत है? बहुत ही महत्वपूर्ण क्वेश्चन है. देखो, ब्रेसेस हर पेशेंट को जरूरत नहीं है. मैं बार बार ये दोहराता हूं कि हर जॉ सर्जरी पेशेंट को ब्रेसेस की जरूरत नहीं पड़ता है. ये कन्वेंशनल ट्रीटमेंट था, आजकल नहीं पड़ता है. और दूसरे इसमें आपको सर्जरी के बाद हम प्लान करके बता देंगे. और ब्रेसेस भी आजकल इतना, मतलब इससे बेटर ऑप्शन है आपको. फॉर एग्जांपल अलाइनर्स, तो वो भी हमारे पास है. और अगर आपको यहाँ नहीं चाहते हैं तो आप यू कैन, आपके शहर में भी आपको करवा सकते हैं. तो जॉ सर्जरी है ना, प्लानिंग के बाद में होगा. आपको इसके लिए हमारे पास कॉन्टैक्ट्स भेजना पड़ेगा, व्हाट्सएप में कंसल्टेशन लेना पड़ेगा या डायरेक्टली आना पड़ेगा. और तब आपको बताएंगे कि हाँ, आपको ब्रेसर की सख्त जरूरत है सर्जरी के बाद, या आपको अलाइनर्स की जरूरत है, या आपको किसी भी चीज की जरूरत नहीं है, सिर्फ जॉ सर्जरी का, या आपको जॉ सर्जरी की जरूरत नहीं है. जो भी है वो हम आपको बताएंगे. तो थैंक यू. आई होप दिस वाज यूजफुल. Yeah, I've answered a lot of your questions. Nice to see you all online. If you have any more queries, do contact us. We send you a WhatsApp number in the link. And if you have any comments or you want me to come on live again with some other topic, I'll find a time and I'll do that as well. So thank you and namaskar.